Welcome to High Truths on Drugs and Addiction, where national experts bring you facts and answers. I'm your host, Dr. Ronit Lev, an emergency and addiction doctor who has served at the White House and practiced on the front lines. Right here on High Truths, you will learn from experts from around the globe and around all aspects of drugs and addiction. High Truths is more than a podcast. It's a movement to unite physical, mental, and addiction health. It brings innovations to connect public health, public safety, and prevention. Our discussions inspire people to implement programs that save lives. To grow this community of information and action, I hope you give us a 5-star review. Come visit me on hightruths.com. Today's episode is sponsored by Drug Free America Foundation, tackling the pervasive issue of substance use and its far-reaching impacts on individuals, families, and community. Drug Free America is supporting ISAC, the International Academy on the Science and Impact of Cannabis, doctors and scientists educating on the harms of marijuana. Hello and welcome to Season 5 of High Truths on Drugs and Addiction. What an honor and joy I have from hosting High Truths. Each episode, I have great discussions with fascinating and knowledgeable people who get me thinking and teach me something new. It's like the Talmudic saying in Ethics of Our Fathers, who is wise? One who learns from every person. And you and I learn so much from our High Truth guests. Talmudically speaking, I guess that means we're all wise. Can you believe, I can't believe, that we already have 210 conversations with fascinating people. I love it. I'm really honored. But more importantly, the conversations we have lead to action, drug policies, and solutions. Talk is great, but as the saying goes, action speaks louder than words. Keeping with our High Truths tradition, the first episode of Season 5 will be just me sharing with you my monologue for the year. This is the one and only time of year where you will hear just from me, and the rest of the season is dialogue with my guests. Here's what I want to cover with you today. First, reflections about this High Truth podcast, then a State of the Union on the drug data, and ending with hopes for our future with solutions and action. So here I go. Reflections. High Truth is like a master's class on addiction, and each of you listening could easily earn a degree on the subject. As a matter of fact, some of you are doing just that. A special shout out to Bob Harkins and his Homeland Security master's students at San Diego State University. Shout out to Dr. Nathan Painter and his pharmacy students at the University of California, San Diego. And shout out to Paula Gordon and her students. All of them use this High Truth podcast as part of their academic curriculum. That makes me very proud. Whether or not you're awarded a master's or doctorate degree, I hope to give all my listeners education, things to think about, inspiration, and even motivation for action. Thanks to you, High Truths has over 76,000 downloads and is ranked in the top 20 of addiction podcasts. That's not bad, given that I'm not investing in any advertisement or promotion. I know that I should, but for now, it's all word of mouth. The majority of the listeners are using Apple Podcasts. I do the podcast on YouTube, but without advertising, it seems that most people prefer the audio-only listening mode. You may be curious who is listening to High Truths. Most of you are from the United States, with California ranking number 1, followed by New York, Montana, and Vermont. Interestingly, some of you are tuning in from Australia, Canada, UK, Israel, India, Ireland, New Zealand, France, Colombia, Mexico, Namibia, South America, Spain, Norway, Sweden, Germany, Denmark, China, and Russia. I do wonder, when I get the podcast statistics, how many of the views and locations are real versus AI or hackers. But I know many of you are real human being listeners, so I thank you. Wherever you're listening from, I'm deeply grateful to you, and thank you for growing this audience and message. The content of High Truths truly provides a 365-degree complete view of the drug issue. I notice that very few people have a wide lens of the global problem. In general, people naturally see the issue from their personal and professional viewpoint. People in law enforcement look at crime. People in healthcare look at treatment and medications. People in research look for innovations. And victims just want any type of solutions. I bring you all those perspectives and more. Each season, I had the honor and privilege of hosting Dr. Nora Wolkoff, the director of NIDA, the National Institute of Drug Abuse. She provides the best federal and research perspective. She has been in a long-standing gold standard on drugs. You can hear my 2025 conversation with Dr. Wolkoff next week. In preparing for this monologue, I reviewed my 210 episodes and wanted to share some of the themes. Each season, I had the honor and privilege of hosting Dr. Nora Wolkoff, the director of NIDA, the National Institute of Drug Abuse. She provides the best federal and research perspective. She has been the long-standing gold standard on drugs. You can hear my 2025 conversation with Dr. Nora Wolkoff next week. Many of my guests have been physicians. I share common language and perspective with my fellow medical doctors. We talk about the various medical aspects of drugs, from brain chemistry, neonatal health, mental health, surgical innovations to decrease pain, the best method of addressing pain, orthopedic procedures that minimize pain, ophthalmology and drugs, dermatology and drugs, and the National Advice Line that assists medical providers to care for patients with substance use disorder. These physicians taught me some key health principles that guide my advocacy and clinical practice. Addiction is a chronic disease of the brain. It's also a pediatric disease that starts in middle school. Drug prevention starts during pregnancy, elementary school, and continues until the brain is developed at the age of 25 to 27. There is no biological drive to use drugs as we have for sex, and therefore it's fair to promote abstinence or at least a delay in drug use until the brain is done growing. Marijuana and drugs affect the hippocampus part of the brain associated with learning. Drug-imposed damage to the hippocampus decreases the ability to learn something new. It takes at least 6 weeks for the hippocampus cells to regrow. Oftentimes, drug use results in anosognosia. Anosognosia, what a great word. The lack of perception that one is impaired. That is why people often state that they feel fine, even better while using drugs, but in fact, anyone else around them can see that they're impaired. On the podcast, I look back and realize we've talked about various methods for addiction treatment. We talked about treatment in street medicine for the homeless, in clinics, emergency departments, and by paramedics. There are medications to treat fentanyl withdrawal and addiction. There's treatment for alcohol use disorder and withdrawal. There are also many treatments for addiction that do not involve pharmaceuticals, and they're greatly underutilized. For example, contingency management is greatly effective and underutilized as a treatment for methamphetamine addiction. I've learned about trauma-informed care and was inspired from the conversation to write an article about ACEs, not the traditional adverse childhood experiences, but adverse career experiences. Some of us, especially in healthcare and law enforcement, has suffered career ACEs. Law enforcement. I have to say something about this group of incredible people. I'm very impressed with my friends in law enforcement. They have a tough job protecting the public, but they go beyond traditional law enforcement and invest in their communities to prevent crime, prevent drug use, prevent death. Because of that, I consider them my heroes and partners in healthcare. I often say I learn the most in how to treat patients from my colleagues in law enforcement. They teach me what my patients are being exposed to. I'm also thankful to my colleagues in law enforcement from a victim's perspective. 911 is called from my emergency department monthly because of the violence to our medical staff. I was assaulted twice on the job, and the SWAT team was called as I lay on the ground. 911, doctor down. Thank you, and shout out to Officer David Smith, who responded with such humanity. The supply side of drugs is crucial. We solved the opioid prescription epidemic on the supply end. We don't have a heroin problem as much because of the supply. We have a fentanyl crisis because of the supply. I talk a lot on the podcast about fentanyl because it's the #1 killer in America for ages 18 to 45. But I also talk about marijuana because there's a huge information gap on weed. I haven't left out other drugs of abuse, such as methamphetamine that is killing more San Diegans than fentanyl, or cocaine, kratom, psychedelics, mushrooms, vape products, misused prescription medications. And I also have not forgotten about alcohol. The researchers and scientists I hosted on High Truths are the most brainiacs. They have looked at population data of Europe, Canada, Australia, and United States to teach about psychosis risk and cannabis use. They have invented new medications and devices to detect fentanyl and treat substance use disorder. They provide data to implement solutions today as well as innovations for tomorrow. Here at High Truths, I spoke with various high-ranking government officials, all of which have a passion to fix the drug crisis, although many have different philosophies on how to get it done. I especially really enjoyed learning the theological perspectives on drugs from a bishop and a rabbi. Many people find recovery by reaching to a higher power. A Gallup poll from 2022 showed that 81% of Americans believe in God. And for these Americans, reaching to God is so important, and we should engage more of our faith-based leaders to prevent drug use and assist people into treatment and recovery. The conversations that drive my passion are from people in recovery with lived experience, as well as victim families who lost loved ones. People in recovery are an inspiration. Talk to people in recovery or who went through a 12-step program, and you will meet the most honest, empathetic, and all-around good human beings. Sometimes I meet people who are not so nice and perhaps what I call a schmuck, and I think to myself, you may not have an addiction, but you should probably go and do some 12-step programs and help that attitude. Many of us who do not suffer from addiction still struggle to find purpose in leading a meaningful life. I spoke to people who have had horrid childhoods, lived on Skid Row in a life of crime and danger. And today, after sometimes several second chances, they are drug-free, and they're not just model citizens, but they are a model of how to live a good life with gratitude and meaning. Parents, my heart goes out to them. Parents should never lose a child. That's not how nature goes. The older you are, that's when you should die first. Death of a child changes people forever. And through High Truths, I have met parents who've changed themselves and the world around for the better after such tragedy. They're spreading the word on the dangers of fentanyl and marijuana. They're passing laws, petitioning the President of the United States, and demanding action. I started my journey in the addiction field when I was on the supply side of the opioid prescriptions. I and my fellow professionals were the problem in overprescribing. Parent activists invited me to be part of the solution, and I've been following their lead and their moral high ground ever since. Over the years, the parents' mission has changed from fighting overprescribing of OxyContin to fentanyl poisoning to marijuana-induced psychosis. Regardless of the drug or poison, the faces of grief have not changed. I'm inspired by the parents who have turned their pain into purpose. They are my moral compass. When I tell you that my podcast is more than talk, but also action, I mean that what I learn from my guests enters my conversation, my lectures that I give around the world and internationally. I'm really fortunate to be invited to speak at academic institutions, communities, healthcare groups, and law enforcement. My highlights for this year, 2024, have been going to the University of Missouri and doing 4 different lectures to different groups around campus. I spoke at Gillette Stadium, home of the New England Patriots, on the Deadly White Powder Symposium. And making my top list for the year was speaking at the United Nations Commission on Narcotic Drugs in Vienna. Lectures is a type of action, but working on health policy is another type of high truth action. While the world was all about COVID, here in High Truths, I was about fentanyl. Even back in 2020, when COVID was the leading and seemingly only discussion there was, fentanyl still remained the number 2 crisis that did not get the attention it deserved. Monkeypox got more attention than fentanyl. Nothing against monkeypox. I diagnosed and treated my first case in the emergency department and even received a monkeypox vaccine. My listeners know that I'm very jealous, envious of infectious disease that usually get all the attention, and I just want and hope to get parity that drugs and drug trends get equal attention and focus as infectious disease. It's possible. With High Truths, I worked on Xing the X waiver to allow anyone with a DEA license to prescribe not just oxycodone, but also medications that treat opiate use disorder, namely buprenorphine. I'm very proud to have written Tyler's Law, the law in California that requires that fentanyl be included whenever a drug test is ordered in a hospital. Julie Shamish, Tyler's mom, and I passed it in California and are moving state by state and federally to pass this no-brainer policy. If we test for cocaine and heroin, why would we not include fentanyl? I had a few legislative failures. You can't win them all, or even most of them. We failed to pass warning labels on cannabis products, as we have on alcohol and tobacco for California. We also failed in banning candy lookalikes for marijuana products to protect children. And we failed on consumer protection on your prescription medications that warn you not to take your medication with cannabis, just like we have warnings not to take with alcohol. I still think these are smart regulations, but sadly for now, California legislators like pot profits rather than public health protections. But we have some wins, and wins this year for California was Proposition 36, the Homeless, Drug Addiction, and Theft Reduction Act. The new law will increase deterrence to drugs and increase incentives to obtain addiction treatment. It is a compassionate law that I was very proud to support. I also was against Amendment 3 in Florida that would have legalized marijuana without including any consumer protections. I urge anyone to learn from the mistakes of California and what happens when cannabis is legalized without including unbiased consumer protections. I also had fun shooting a commercial for Florida. I tend to be a futurist when it comes to drugs. Years before naloxone or Narcan was over the counter, years before governments were into naloxone mass distribution, I was offering free naloxone prescriptions in person through our San Diego task force and then through my website to anybody who needed it for free. It was the right thing to do. This is my reflections on some of the ways of how High Truths provided action as well as inspirational conversations. Let's talk about data. This is the State of the Union on drugs. Data sounds boring, but to me, data on drugs is not boring. It drives health policy, directs action, and frankly, is tragic. Everywhere I go, I meet people who've experienced a drug death in their close circle in their families. So I don't think of it as data. I see family tragedy. Data changed my life. Back in the good old days, sarcastically speaking, of the opioid prescription epidemic, 100 people a day were dying from drugs. People blamed and were angry at the medical community, so I studied the problem. I partnered with our San Diego medical examiner and reviewed every single person who died of a medication, any medication. That was 254 people in 2013. I reviewed all prescriptions for the 12 months before these people died. This death diary data changed my life as a doctor and created the safe prescribing guidelines that remain in use today. So let's look at the death data today. The father of epidemiology said, "Death is a fact and everything else is conjecture." The CDC, National Vital Statistics System, shows the most current data. The latest data is listed as provisional and incomplete, as many deaths require longer investigations. Accounting for these investigation delays, the CDC generates predicted counts. People are celebrating the downward trend of this predicted mortality data. In July 2024, the predicted death count was 94,112 a year, or 258 deaths a day. In comparison, the peak predicted death toll in May 2023 was at 113,212, or 310 deaths a day. So it is a downward trend, but it's still much worse than the good old days when I, the physician, was at the supply end of prescribing opioids, and people were screaming and furious at 100 deaths a day, and today we're smiling at 258 deaths a day. The CDC also looks at non-fatal events using their DOSE system. DOSE stands for Drug Overdose Surveillance and Epidemiology. The data is obtained for emergency departments and inpatient hospitalization. It's not perfect, as not all states are participating fully as they should be. The data from September 2024 compared to September 2023 shows a 15% decrease in emergency visits due to all drug overdoses. This is another good sign. Both deaths and non-fatal overdoses are going down. NEMSIS data comes from the National Highway Traffic Safety Administration and includes EMS or 911 data from 54 states and territories who treated over 36 million calls in 2023. The 12-month data between December 2023 and December 2024 shows a national 3.4% reduction in fatal overdoses and 17.8% decrease in non-fatal overdoses, and 16% of people less reduction in receiving and needing naloxone. So this data matches the CDC data of decreased fatalities and decrease in non-fatal overdoses. All good news, but we still like to do better. NSDA data and monitoring the future are data that look at use. So the National Survey on Drug Use and Health, NSDA, and Monitoring the Future are the two main surveys that capture drug use outside the morgue or healthcare system. NSDA provides data on use of tobacco, alcohol, and drugs, as well as mental health, from over 67,000 surveys of people aged 12 and older in the United States. Highlights from 2023 shows no surprises. Past month use of alcohol was number one with 134.7 million people using alcohol, followed by tobacco products at 49.9 million and marijuana at 43.6 million. 17.1% of the population suffers from addiction or have a substance use disorder, and that's nearly 50 million people. And the drugs are number one, alcohol. All drugs, including marijuana, are number two, and number three is just marijuana use disorder. What's not highlighted, but very important from the survey to point out, is that most people do not use tobacco or drugs. 77.3% of people are tobacco and vaping free. 75.1% of people did not use illicit drugs in the past year, and most people did not binge alcohol, defined as drinking 5 or more drinks for men or 4 or more drinks for women on one occasion. The social norm is not to use tobacco, drugs, or drink excessively. I've learned from my high truths experts to always promote this social norm, so it's important to emphasize that most people do not misuse drugs. While the majority of drug discussion and treatment efforts focus on fentanyl, the NSDA survey shows that methamphetamine or stimulant misuse affects 9.7 million people in the past year, which is more than the 8.9 million that are affected by opiate misuse. This identifies a very serious mismatch in our treatment efforts. Methamphetamine treatment is not getting the treatment implementation that it warrants. The other big gap identified in the NSDA data is that kids aged 12 to 17 who have a diagnosis of substance use disorder that suffer from addiction, only a small percentage, 3.4%, received treatment. The majority of them said that they didn't have a problem. They had anosognosia. Anosognosia is the brain condition that people lack the perception that they are impaired. People with dementia suffer from anosognosia, and people with substance use disorder get it too. Monitoring the Future is another important survey. It's been around since 1975 and is a key drug use survey that includes about 25,000 kids in 8th, 10th, and 12th grade, as well as some adults. I'll share a few of their 2024 highlights. The good news is that drug use is down in young people. The COVID-19 pandemic resulted in increased kids at home and less kids using drugs, and those same kids continued their drug-free habit. Adolescent drug use continued to drop in 2024. Like the NSDA data, the Monitoring the Future data shows that most adolescents abstained from all drugs, including tobacco and alcohol. More kids are making the smart decision to protect their brains. The minority of kids who use drugs chose alcohol as number one, vaping number two, and marijuana number three. What about the Delta 8 products? Monitoring the Future surveyed use of this synthetic THC product that is commonly sold openly in smoke shops and gas stations. I've even seen them at the mall. The drug has never been tested by the FDA on humans or lab rats, and yet these semi-synthetic marijuana products have been made legal by Congress's misguided hemp law. Congress legalized hemp as anything that is not over 0.3% dry weight Delta 9 THC. The smart drug profiteer said, hey, Delta 8 products are hemp because they are less than 0.3% dry weight Delta 9 THC. They are Delta 8 THC. So Delta 8 products have become legal unless made differently at the state level. Delta 8 product use was reported at 12.3% of 12th graders across the United States. The important news is that in states that ban Delta 8 products, use was less than half of that, 6%. So this is an example of smart drug policy that protects youth. Sadly, hallucinogen use reached an all-time high for young adults at 8.9%. 10 years ago, it was 3.8%. This trend comes at no surprise given the movement to legalize mushrooms and psychedelics and the ease of availability of the products in the community. Let's talk now about the supply side of data. Death, hospitalizations, and use are on the demand side of drug data. But what about the supply? What's being sold on the street? One of the areas that we can get that data is from the Customs and Border Patrol. Shout out to the incoming Customs and Border Patrol Director, Rodney Scott, who has been on this podcast, but more impressively created the CBP data dashboard. Looking at the dashboard, all drug seizures for fiscal year 2024 totaled 573,000 pounds, up from 549,000 in 2023. But I don't know what that means. What's a pound of drugs? A pound of fentanyl is very different than a pound of methamphetamine. 1 pound of pure fentanyl works out to 227,000 potential people dead using 2 milligrams as a lethal dose. The DEA is another data source. DEA data on fentanyl potency shows a positive trend. The lethality of illicit fentanyl pills was 7 out of 10 pills containing a lethal dose. Now the potency is down to 5 out of 10 pills being lethal. Higher price of illicit drugs results in more dilution and decreased potency of the product. It also means less deaths. So we want illicit drug prices to be high. We want expensive drugs because that decreases use. The illicit drug market is a multi-billion-dollar industry, and it's not easy to find the street price of drugs. But I tried. What I found is that heroin is going for about $150 to $500 a gram, and methamphetamine is cheap at $20 to $40 a gram. NDUS is the National Drug Early Warning System and another data source for drug trends, new drug trends. And their novel surveillance system evaluates drug trends based on machine learning. For example, a monitoring report from November 2024 showed a spike in interest in N-ethylpentadrone. NEP for short is a synthetic psychoactive chemical in the cathinone class. Cathinones are also known as bath salts. Reddit users reported snorting NEP as a preferred route for a short euphoric trip that lasts just a few hours. So this has been my abbreviated State of the Union on the data of drug mortality and non-fatal events, use, and supply. There are some positive trends, and everyone is taking credit for this year's decreased fentanyl and drug mortality, as they should, because each stakeholder has a very important role, from law enforcement to primary prevention, drug treatment, naloxone distribution, and recovery. So where do we go from here? We still have a very serious drug crisis. What is the big picture in terms of goals? Let's start with mortality. We're at 258 deaths a day, down from 300, which is a decent trend. However, the short-term goal should be to get down to 100 deaths a day. That would take us to the good old days of the opioid prescription crisis. Not a final goal, but a short-term goal. The long-term goal would be to get us back to the 1999 overdose rate of 2 per 100,000 population. At the peak of the opioid prescription crisis, when people wanted blood out of Purdue Pharma for overprescribing oxycodone, we were at 5 deaths per 100,000. Now, today, we're at 30 deaths per 100,000. That is still 6 times higher than the good old days of prescription opioids. The best way and the rapid way to reduce deaths is by attacking the supply. Fentanyl is a weapon of mass destruction. Our country is under attack with fentanyl as a #1 cause of death from age 18 to 45. It's coming from outside our borders. We don't need to wait for a fentanyl spraying drone to fly over a stadium. Today, right now, we're experiencing that type of destruction. How does our disaster and EMS experts prepare for a fentanyl drone attack? They indeed train for that event, but the reality is that you can't really prepare. I learned that from the experts. They say it's impossible to be fully prepared. It's much more important to prevent such an attack from happening in the first place. I am very hopeful for President Trump's goal of reducing fentanyl deaths by attacking the upstream supply invading our country from foreign sources. I support whatever it takes. Laws that deter drug dealing and open drug use, supporting public safety, border safety, closing the tax loopholes that allow importing of goods that include fentanyl importation, breaking the trans-criminal organizations, and even naval ships monitoring our waters to prevent transportation of chemical precursors. Americans are precious. Our lives are precious, and too many have died unfairly. There have been threats of tariffs on our neighbors and on China to prevent drug and human smuggling. Let me ask you, would you temporarily pay an extra 10 or 25% on some foreign-made goods to save even one person from a fentanyl death? I think most of us would. Shut the supply, save lives. It's that simple. They say the war on drugs has failed. It's a catchy phrase, but what does it mean? For some people, it means allowing all drugs. I disagree. A society that does not protect its kids and population and just watches people die in the streets, that's not a just society. Perhaps a wall on drugs means avoiding mass incarceration for simply using drugs. I would agree on that to an extent. However, the other extreme of allowing open drug use and dealing is also not a just society. Being soft on crime is not compassionate. It's cruel. It's cruel to the victim and cruel to the offender by robbing them from an opportunity to improve their lives. Appropriate drug deterrence and consequences for breaking laws that harm others is providing compassionate justice. Drug courts and incentives to treat people gives them hope and saves people's lives. Drug supply matters, but it's just one side of the three-legged stool of drug control. We need supply as well as prevention and treatment. People say we can't arrest our way out of the problem. True. But we also can't naloxone our way or suboxone our way out of the problem either. But we can prevent our way out of the drug crisis. Upstream prevention worked for tobacco. We made cigarette smoking uncool unless kids started smoking. Upstream prevention was the answer to the opioid prescription epidemic. We had less Americans get hooked on pain pills. Drug prevention is evidence-based and cost-effective. We can teach kids to protect their brain until they're age 25 by abstaining from drugs. It works. There's no biological drive to use drugs. Some people may have a genetic predisposition, but by applying prevention science, we can have the next generation of Americans who are resilient. When life gets hard, and everybody has moments of struggle, we should have a healthy toolkit to reach for that avoids drugs, alcohol, and tobacco. Addiction is a pediatric disease. Prevention starts when women are pregnant and protecting their unborn child and continues from preschool through college when the brain is fully developed. There are certified educational programs that have scientific results proven by controlled studies showing that when kids receive the prevention curriculum, they end up with higher academic achievement and lower drug use. I'm very hopeful for Bobby Kennedy's leadership in making America healthy again. We currently have a focus on treating chronic disease rather than a focus on preventing disease. We seem to love the drugs and medications that treat obesity instead of going upstream to prevent obesity with healthy eating and living. The same principles apply to substance use prevention and mental health. All kids in school and homeschool should receive age-appropriate life skills education. This would help with substance misuse, mental health, and even obesity. Our drug-free community programs across the country are an important government investment. For every dollar spent, we save $2 to $20. Investing in prevention programs can save up to $33.5 million in cost of substance use. We need to create incentives and invest more in primary prevention that prevents and delays the onset of drug use. It's an investment in America. It's tough because all around us, kids are exposed to how wonderful drugs are. They see it on billboards, on TV, and social media. They're being targeted. with advertisements to use alcohol, marijuana, vapes, and psychedelics. The addiction industry has learned from the tobacco days that targeting youth creates lifelong customers. So we need to do better in protecting our kids from this type of exposure and marketing. We also need celebrity heroes that share how cool it is to be drug-free. As Whitney Houston sings, and I will spare you from my singing, but you can imagine her voice saying, "I believe the children are our future. Teach them well and let them lead the way." The third part of our drug stool, along with supply and prevention, is treatment. Investing in prevention will decrease the pipeline and need for treatment. But as a great nation, we want a healthy society. That means providing quality addiction treatment of various modalities. About 70% of the population of 48.5 million people suffer from a substance use disorder in the past year. 28.9 million from alcohol and 27.2 million from drugs. People who suffer from addiction deserve compassionate treatment. There's no one-size-fits-all model, but we can do better in making sure all Americans who suffer have access to quality, results-oriented care. Of the people with a severe substance use disorder, there is a subset that are resistant to treatment, and we need to do our best to keep them alive until they're ready to seek care. As Patrick Kennedy has stated, we want to meet people where they are, but not keep them there. Harm reduction should be aimed at this population, not to facilitate drug use, but to use science-based strategies in keeping people alive with the ultimate goal of entering treatment and recovery, not to give up on people. We have about 10% of Americans, or 22 million people here, living in recovery. They are an incredible testament that treatment and recovery from substance use disorder is possible. We need to learn from these Americans on the best methods of how they reached recovery. They have the answers. We also need to support them in their life aspiration of employment. Like Elton John, the music legend, people in recovery are the best motivators for drug treatment and prevention. Elton John was recently quoted as saying legalizing marijuana in America and Canada is one of the greatest mistakes of all time. He said it's addictive and leads to other drugs. Quote, "And when you're stoned, and I've been stoned, you don't think normally." Quote, "You make terrible decisions on drugs." Elton John was named Time Magazine 2024 Icon of the Year. With this drug statements, Elton John is a celebrity prevention and recovery hero of the year. And he gets extra brownie points in heaven. His words probably just saved many lives. In conclusion, I have much hope to tackle the drug crisis by attacking the supply, providing treatment, and preventing addiction. Drug deaths are preventable. We can and must end our current fentanyl crisis. Drug supply matters. It matters a lot. Shut it down is the quickest way to save lives. Addiction is treatable, and Americans deserve compassionate and high-quality care. There is no one-size-fits-all treatment, but healing is available for everyone. And drug prevention works, and where America needs to invest for our next generation. May the memory of the people who died from drugs be a blessing to all of us and to lead our communities to a better future. I'm looking forward to more high truths in 2025, and thank you all for listening. And for those that have reached out to me with ideas and suggestions, I take to heart and really think about what you share, the current struggles, and potential solutions. I learn a lot from you. And bit by bit, together, we all make the world a little better. I wish you a happy and healthy 2025 with a little bit more high truths. Thank you for listening to High Truths on Drugs and Addiction, where you learn from experts from around the globe and around all aspects of drugs. This week's episode would not be possible without the generous support of our sponsor. A sincere and warm thank you to Drug Free America Foundation. Visit dfaf.org. And Isaac, the International Academy on the Science and Impact of Cannabis. That's IASIC1.org. High Truths producer is Dave Rivas from Davey Boy Productions. I'm your host, Dr. Oneet Lev. We hope we brought your day a little bit more high truths.